Good morning, everyone. I'll start with a brief update on my comments from Monday. Following the press conference, I signed an executive order to establish the Racial Equity Task Force. I'm now working with Racial Equity Director, Susanna Davis, who will be the chair to finalize appointees so they can begin their work as soon as possible. I also want to give you an update on what we're looking at this week. As I said over the last few days, we've been working with the Department of Health and the Agency of Commerce to determine what health requirements are needed so we can reopen indoor dining at restaurants, and we're hoping to officially announce this on Friday. And while I think this is still possible, Dr. Levine will give you an update on the situation in Winooski that we also need to continue to watch. When we get to indoor dining, it will be a very controlled opening at first, with physical distance being a priority. So I want to be upfront. We still have a very long way to go to help our restaurants get back on their feet, but we've got to start somewhere, and that's what we intend to announce on Friday. As you know, not only do we have to further open the door to the hospitality sector, but we also need customers to fill the seats. So we've been working on a plan that will allow some out-of-state visitors to come to Vermont without a quarantine. Our Restart team has been working closely with Dr. Kelso, our epidemiologist, Department of Public Safety, the Agency of Commerce, and our modeling team led by Commissioner Pichek to create a plan that can safely allow for this to happen. On Friday, we'll be able to provide an update on our approach, but it's focused on setting a threshold based on what we're seeing for active cases in Vermont and the Northeast region, so we have a data-driven, scientific way of looking at the health risks. At the same time, we're also looking at whether we can safely increase capacity at lodging facilities and campgrounds as well. Again, this is an area where I know we're currently not allowing enough to sustain this important sector of the economy. But nothing about this virus is ideal, and we're doing all we can to open us up as much as we possibly can, as safely as we can. The more we learn and the more data we have during these restarts should let us open more areas and hopefully a bit quicker. But for now, we must continue to take a cautious approach, turn the spigot a little at a time to make sure we keep moving in the right direction on the health side of things. But we also know our businesses here in Vermont are struggling to simply survive, which is exactly why it's so important for the legislature to move as quickly as possible on the economic relief package we submitted to them last week. Phase 1 of the package is meant as emergency relief, so our businesses that were hit the hardest make it through this crisis. As we know, and as tempting as it might be, we can't just simply flip the switch on the economy, which is why those funds are so desperately needed, especially by small business owners in the hospitality sector in particular. This pandemic has forced all of us in state government to be nimble and move quickly in many areas to protect public health. But it's also created an economic crisis that requires an equal sense of urgency. These are extraordinary times that require extraordinary steps, and those on the edge of losing their businesses need economic relief, and they need it right now. My team continues to work with the legislature to move the package forward as quickly as possible so we can help these businesses not only survive this transition to reopening, but put them in a position to thrive as well. With that, I'll now turn it over to Dr. Levine for an update.
As the governor stated, my comments this morning will be limited to Winooski. As you know, we've greatly expanded our testing throughout the state, and we fully expected this effort to reveal more cases. As I reported earlier, through the work of our epidemiology team, we recently identified a cluster of cases in Winooski. And with the support of Winooski city officials and community health centers of Burlington, we quickly arranged a week of testing opportunities for Winooski residents. On Monday and Tuesday, 200 people came down to be tested in Winooski, and the testing did reveal additional cases in the community. From these pop-up sites, the EPI team is currently in the process of verifying, validating, and deduplicating this data, which I have to remind everyone is very early and what we've just found out in the last several hours. So I do not have a lot of details for you, but we are interested in being as transparent as possible, but please understand that the details will be forthcoming. There may be in the range of 10 to 20 additional cases. We will have more specificity to this once all of the analysis has been performed. This is the nature of this virus. When we find clusters or identify outbreaks, we expect our case count to increase. Our contact tracers work hard to find out who is at risk of illness and reach out to them to slow down the spread of disease. We are prepared for this. In Winooski, our collaboration with the city and community partners continues, and this will see us through the coming days and weeks. We will expect to find more cases, but with contact tracing, coordination with the community, careful isolation and quarantine, this outbreak can and will be managed. People who may be at risk of contracting COVID-19 from someone who has tested positive will be contacted by the health department to make sure they take steps to stop the spread of the disease. While Vermonters have done much to flatten the curve, these cases illustrate the fact that the virus is still active in our state, as it is around the country. And especially now, as we carefully take steps to restart Vermont, we call on everyone to continue to practice good public health measures, such as wearing facial coverings, limiting close interactions, hand washing, and keeping a diary of contacts. The information we have about new positive cases, as I've stated, is preliminary at this point, and I really cannot share any further details. Thank you.
With that, we're going to open up to questions at this time.
Thank you. Governor, I guess just to start off, where do you begin? I was wondering if you had any thoughts about the president's actions on Monday night, what happened with the protests and him walking to St. John's Church.
Yeah, I was watching in disbelief. You could see it unfold right before our eyes. I knew as soon as he said he was going to someplace important that it was going to be some sort of spectacle. And you could see a peaceful protest that quickly turned into something much uglier. You know, I know we don't have to accept the violence that we're seeing across the country and the looting and so forth, but we have to listen. We can accept peaceful protests for what they are. There's a deep amount of frustration throughout our country, and it's a time to listen and time to reflect on that and time to do better. And I think we all should step up because we need leadership right now. We need someone to unite us. I'm trying to do that here in this state, and I would suggest the president should read what President Obama wrote, what President Bush wrote, and follow that lead, because Americans are desperately needing us to unite them. We don't need more polarization. We don't need more division. We don't need to incite. We need to unite. And this is something that's truly discouraging as we watch what's happening throughout our country.
And just a quick follow-up to the announcement that you made today. So you said that we're going to be rolling out a framework or some policy to potentially host people from out of state. I guess I'm sure more details will come, but how will we make sure that we're not opening up the floodgates and everybody says, hey, it's okay to go to Vermont?
Yeah, we'll be talking about that a little bit more on Friday, but we've got an approach because there are some areas throughout the Northeast that have low positive case rates like we do. And so we're looking at how do we open the doors so that there's some cross-border reciprocity so that we can continue to get back to some sort of normal and be able to move freely. So we'll be able to talk about that a little bit more on Friday as we get to refine some of the details. But that's our hope, that we can move forward and try to open up things a little bit more.
Governor, can you, since we met Monday, we've had some more protests. Vermonters are speaking out. There was another one last night in St. Albans. There's one right now in Heinsberg. We heard task force and some people's eyes glaze over.
Yeah.
You know, is this just is this going to produce something tangible? Is this going to produce change in our state? And how much change do we need to see in our state?
Well, again, you know, task force to me means the same thing, and you do kind of glaze over when you think, oh, here's another government gimmick in some respects. But we've been working on this for a number of months. This isn't something new, but it's appropriate at this point to move forward with this. We hope to have more details. We hope to learn more with this task force, and I think it'll be fairly swift and put things into place that I think will help. But at the end of the day, it's really about us. You know, it's about each and every one of us individually to not accept the rhetoric, to do things better, to be better role models. I've talked about that a lot over the last number of years. we have a responsibility, each and every one of us, whether we're leaders in across the state, or we're leaders in our own community, or we're just leaders in our own household. Just be better people, act respectfully, treat others the way you want to be treated. And I think that's the bottom line is it's in our hands, and we need to act upon that.
Do we have a really entrenched problem here? Are we any different from any other state? Are we racist?
We're not immune to what's happening across the country, and I think that we just have to accept that and open our eyes and make sure that we're using the right language, because that means a lot. We may not think what we're saying sounds racist, and we don't consider ourselves racist, but some of what we say and some of what is heard means different things to different people. And we just have to be really aware of that. And I think that it's so important to at least educate ourselves on what it is we say, or what do we do that might give somebody that sense that we don't care about what they think.
Governor, a couple of quick questions, but along the lines, I'm hearing a lot of feedback from business that we really need this money right now. You put forth your economic stimulus package. It's in the legislature right now. Do you have any sort of message? How can they, speed up the process? I know it has to go through the committees and
Right.
everything, but
No, I mean, we're trying to be there to answer any questions. I know it's a lot of money. It's $400 million, but it's a lot of money that they need in the private sector to survive. Many of these businesses are on the brink of bankruptcy, and we owe it to them. This is what that money was intended for, to make sure that we're protecting people and our businesses, because we try to protect our businesses and keep them open and stable. We provide for employment down the road when we can open up further. So we're not just looking at the immediate needs. How can we survive and thrive? So what is it we can do to make sure that we have people working a year from now as well? Because if we don't have the businesses a year from now, we're not going to have the revenue. We're going to continue to have budgetary problems. So what we do now is laying this foundation is really, really essential to the survival of a number of businesses.
a quick follow-up on that. These folks who are literally screaming, I can't last much longer. They have to move. They can't. So they hear your answer. They hear the leadership over in the legislature's answer, but it's not putting anything out there to help their business.
Yeah. Well, again, we put the package forward. I know that the legislative leaders have told me that they will act quickly on any measures we put before them in regards to COVID-19, and I take them at their word. And I know that I hope they understand how dire this situation is for many across Vermont, because again, this was what the money was intended for.
And finally, just quickly, on the recreation front, it sounds like you're loosening up again a little bit. There's a lot of outdoor activities that, now that there's a 25-person gathering, Little League Baseball, auto racing, there's soccer camps, all sorts of stuff like that that draw crowds and things. A lot of them from the state coming in. Is this the start of opening that stuff?
Well, certainly we have to walk before we run, and we've when we contemplate where we were when we were having no mass gatherings at all, we were at down to 10. Now we're open up to 25, and hopefully we can open up further as we move forward. But again, having indoor dining opening up would be a step in the right direction. But we're a long ways away from getting back to anything near normal. I mean, we see it on the national stage as well with sports in particular, whether it's NHL, NFL, NASCAR. There's no there's nobody in the stands. So they recognize that it's the mass gatherings that are the problem. So we're going to, again, continue to open up as quick as we can. I'd say Little League, those are the areas that we'd like to get kids back to doing something normal as quick as we can. So we'll be looking at that over the next couple of weeks as well.
Kind of hard to peel a Little League parent away from the grandstands.
Yeah, but they aren't to the magnitude. They're not thousands of people gathering to watch a Little League game, at least in-state, if there's no tournaments and so forth. So, again, small and then increase in size when we can prove ourselves and watch the data.
All right, we'll move to the phone, starting with Ann Wallace-Allen, VT Digger.
Hi, Governor. With the first sort of cluster that you've noticed in Winooski, I'm wondering, what would it take for you to start feeling that maybe you had been turning the spigot a little too rapidly and needed to dial it back? What would be a sign?
First of all, I just want to talk a little bit about the outbreaks because, as you probably recall, in numerous press conferences as we started to open up the economy, I warned everyone that we're going to start seeing more cases. There were going to be some outbreaks, but the trick is to confine them and surround them so that we can mitigate them. So this isn't unexpected, but again, concerning, but not unexpected. From my standpoint, I'll let Dr. Levine talk about this and in his capacity as well as with the epidemiologists. But from my perspective, if we saw numerous outbreaks throughout the state at the same time, I would get concerned, very concerned, and that maybe we were going too quickly. But sporadic outbreaks are something that I think we have to get used to and accustomed to. Dr. Levine.
And I clearly sign on to those comments. Every bit of the way, we've been discussing the fact that there's always the potential for selected outbreaks, whether they be within a community, whether they be within a facility. And all of our testing strategies are really identifying what those high-risk places may be, looking for vulnerable populations, and making sure that we are doing some surveillance in those populations. We had another prison tested this week where all of the inmates and staff that were tested were negative, which is great news. We've had pop-up sites throughout the state where literally the majority, minus one or two cases, of asymptomatic Vermonters tested negative. So lots of absence of disease we've been demonstrating, but at the same time, there's still a steady trickle of disease, and now we have more of a cluster that we've identified. The strategy is still, if I could use the terms that are being used nationally now, the box-it-in strategy. So making sure that we maintain our testing capabilities and our capacity, isolating cases that are found, doing what is truly exhaustive and comprehensive contact tracing, and making sure that appropriate quarantine measures are put into play so that you can truly contain the outbreak. And we're adding to that now more refined testing strategies within outbreaks as well, so that we can always be on top of these and make sure that from the outset we know exactly what we're dealing with and how best to contain it.
Oh, all righty. Sort of related to that, the demonstrators are assembling in groups that sometimes number more than 25 and do not always appear to be social distancing. Have you talked to the organizers about that? Or has anyone from the state talked about that?
Dr. Levine?
Yeah, so not directly to the organizers, who you're not always aware of who they are, but clearly, publicly, at this forum specifically, dedicated an entire segment to my concern, but the concern that's being shared by public health officials nationwide, that the scope of some of the demonstrations that we're seeing on television every night, where I must say there is a fair amount of adherence to facial covering and masks, but clearly social distancing a challenge in those settings. It's too early to see anything register on the caseloads around the country, but obviously we all know that within 1 to 2 weeks of such close contact, if there were people who were in an asymptomatic state but able to transmit the virus, we would begin to see outbreaks occur. I've publicly stated that I do believe there are ways, especially in Vermont, to be very responsible with protesting, not to take away, again, any of the reasons for the protest, which are quite valid, and we've validated them here specifically, but to make sure that we don't compound a set of problems that people are protesting about with yet a greater problem of new rates of disease, perhaps hospitalizations, perhaps really severe outcomes that the protests may have generated. So I think, again, trying to protest in a way that is COVID responsive, if you will, is really the message I'd like to continue to get out there.
All right, thanks so much.
Mike Donahue, The Islander. Mike.
Hello.
Yep.
A former editor mentioned to me this week that in talking with a hospital leader, there was some mention of a financial package or incentive the state or hospitals receive dealing with COVID-19, and this isn't the first time we're hearing something like this. I'm wondering, is there any financial, whatever, benefit, incentive, whatever you want to call it, received by Vermont in any way when COVID cases are found in Vermont, or for deaths to be classified as COVID related? Does Vermont or other states get something for handling these cases?
Well, the CARES Act, Mike, was put forward for these purposes as well. We have to protect our healthcare system. I've talked about this a lot. When we talked about it sounded like a lot of money, $1.25 billion, but again, when you consider the emergency itself, and then for $200 or $300 million, then you consider the economic package we put forward of another $410 million, and then the healthcare situation is something that I'm going to let Secretary Smith talk about, but that could be another $300 to $400 million. So there's not a lot of money left over after that, and we have to prepare in case there is another emergency or situation in the future. So we want to make sure that we're
just to be clear.
Yeah.
Just to be clear, it was more of a, for every gap, there's a, I don't know, a check written for $30,000 or $13,000, or
not-
what I sort of got the impression that for every case, the feds then send you another check or something like that.
not that I'm aware of. No, that would be the first time I've ever heard of that.
Okay, and just as a follow-up, I would extend it, is there any benefit or incentive? You're doing a lot of testing, and there's a push for the tests and everything like that. Who's paying exactly for all those tests? Is the federal government paying for everything?
Yeah.
And is there any incentive there for Vermont because of the number of tests? Do they get a bonus or whatever you want to call it?
No bonus. The federal government is reimbursing us for that, and part of it, again, would come out of the emergency funding that we receive as well. But I'll let Secretary Smith answer that directly.
Thanks, Mike. This also gives me the opportunity to talk about a couple of things during this pandemic. One, what we did do to help the healthcare system, because it is a system, and secondly, what we plan to do. In terms of tests, we do have about $54 to $55 million that the federal government gave us to conduct testing that we are using and we have used during this pandemic. But let me just go back, because I think this is important. During the pandemic, we had two major objectives. The first objective was to make sure that our healthcare system was financially and operationally viable. If you remember correctly, we had basically shut down the healthcare system in order to have the number of beds that we would need in case this trended in a very adverse direction. This pandemic went in a very adverse direction. The second objective was to make sure, once we started coming out of this, is to make sure that we put stability into our healthcare system. So during the pandemic, we stood up 5 programs that were stood up in order to make sure that the system was financially viable and operational. And those included providing financial relief to hospitals, 2 of which we provided financial relief, the Brattleboro Retreat and Springfield Hospital. And then we stood up another program that dealt with non-hospitals expenditures, and that was roughly about $4 million. And we also established even another program that dealt with making sure there was financial viability and operational viability in our designated agencies and our specialized service agencies as well. And then we wanted to make sure that those that receive Medicaid payments had some cash flow during this period, because if you remember, there were a lot of patients that weren't showing up for health care, either because we had shut down the operations of those elective surgeries, elective procedures, or number 2, people just weren't showing up. So we established a opt-in sort of prospective payment Medicaid program for those entities that receive Medicaid. And then lastly, we established what is called an extraordinary financial relief for nursing homes because they were under stress as well. The next sort of turn that we're looking at is, what do we do in the future to put stability in our system? And that's what the governor was talking about, and that's what the governor has tasked me to do, is to look at how we can put financial stability into our healthcare system, and that's going to be quite expensive. Our healthcare system suffered quite a body blow during this, and we're about on the verge of looking at that right now and announcing, up to $375 million in terms of a program that will look at the stability. It would be an application program where entities would apply for the money and would be reviewed. We probably use the same sort of procedures we used in the 5 programs that we stood up, which were all application process and looked at need in terms of where we're going. But that's what we're doing with our healthcare system right now. They are in need, perhaps not in the urgent, desperate need that some of our businesses are in. That's why the governor put the economic package first on this. But second, we really need to put stability into our operations.
Okay, thank you as always. Appreciate it.
Lisa, the AP. Lisa, AP.
Yes, this is a question for Dr. Levine. Can you talk a little bit more about the Winooski cluster? Is it where it is? Is it in a facility or a housing unit, or where is that?
So the most I can tell you at this point is it's in the community of Winooski.
Okay.
But it's not involving like a long-term care facility like we've discussed here at other times. Not.
Okay. And then in terms of of when we might allow some out-of-state residents to come in, so it sounds like that could be limited to people from certain states. Is that right? I know you're going to talk more about this later in the week, but is there anything more you can tell us?
Yeah, no, it would be certain states, probably in the Northeast region, and then maybe specific areas within those states as well.
Okay. And would people be required to be tested or anything like that?
No, well, that's not what we're contemplating at this point. We're trying to do this without a quarantine, without a test.
Okay. Thank you.
P, VPR.
Commissioner Levine, the Vermont Medical Society yesterday pronounced racism to be a public health threat. I'm wondering if you endorse that pronouncement, and if so, if you can talk from an epidemiological perspective about ways in which racism is manifesting in medical outcomes in Vermont.
Dr. Levine.
Yeah, thanks, Pete, for bringing this issue up. So I have read what the Medical Society put out, and I do support that. At the same time, the American Medical Association and my own, as an internal medicine physician, my own professional organization, the American College of Physicians, have come out with similar types of statements. Most of them are on the angle, as is appropriate right now, of denouncing racism and racial injustice and how it interfaces with current events. But these organizations have historically and continue to also give a lot of dialogue concerning how structural racism feeds into adverse outcomes in terms of health and health care. I didn't bring a copy today, but I would love everyone to go to the healthvermont.gov website and look under State Health Improvement Plan. Every 5 years, we need to update our State Health Improvement Plan, and that was just done. It comes on the heels of a process called State Health Assessment, which is also a document on the website. This year, more than any other, not necessarily in anticipation of current events, but in recognition of historical trends, we chose to really make health equity our dominant theme. So during the state health assessment process, which is presenting lots and lots of data across all aspects of health, we enlisted the aid of 75 to 125 organizations around Vermont, many of them who would consider themselves to be in some way discriminated against or feeling like they do not enjoy the same opportunity for healthy outcomes as others. And these are very diverse organizations, some determined by race, some determined by religion, some determined by socioeconomic class, some determined by gender preference. The list goes on and on. It was not what you would consider to be the most traditional grouping of organizations coming to the table. It was incredibly all-encompassing and diverse, and it was meant to be so. One of the best outcomes of that process was that each of these groups who felt in some way that they were not being served well got to hear from all of the other groups and really understand that it wasn't just them, and that when we talk about such harsh terms in our society as discrimination or bias, that it's actually very, very broadly contextured. And when we showed our data in the state health assessment, we really looked at all of these variables and how they actually fed into the status of health in Vermont. And one could look at an outcome measure where Vermont looked wonderful, but when you looked specifically at a group whether that be a group determined by gender preference or race or income or some other factor, you began to see that not everyone enjoyed that same high level of positive outcome. So the State Health Improvement Plan process was really to say explicitly, we're going to look at this data that we've taken so many pains to address and gather, and we're going to look at it in new and unique ways. And we're going to really drill down and find out why certain groups are not enjoying the same opportunities for health, and how can we correct that. So we chose a number of specific areas that we wanted to focus on: chronic disease, mental health, substance misuse, oral health, child development, and resilience. And looking at those, we chose to really look at them in the eyes of what we term social determinants of health. Who does and does not enjoy the same access to healthy food? Who has food insecurity? Who does not have the same security regarding housing? Economic insecurity. The list goes on. And this is all pre-COVID, may I remind you. These things have only been, as we've seen, exacerbated by COVID. So we chose to look at all of those things, and on a foundation of, let's look across all systems and understand why not everyone enjoys health equity. And I'll remind everybody, health equity means having the same opportunity to enjoy healthy outcomes as everybody else. So that's our whole foundation of what we're doing in public health and across healthcare in Vermont. So many of our healthcare systems were allies in this effort, and we're really starting to look at their delivery of patient care through the lens of how do I impact these determinants of health besides healthcare? How do I impact the societal ills that I've begun to outline for you along with healthcare, knowing that we can't make everybody healthy just by having the best healthcare system in the world that spends the greatest amount of money on all the fancy new technologies and tests and treatments. We need to actually go more fundamentally down to the level of what's going on in our societies, which Vermont is not immune from, and Vermont is really taking a very hard look at. So I know I've created a rather wordy response, but I hope I got at what you were looking for.
One quick follow-up. Have you identified any specific public policy reforms that you think would get Vermont closer to health equity?
Oh, innumerable ones. Let me, again, go pre-COVID and talk about some of the initiatives that the legislature was looking at seriously, the governor was proposing seriously, till we kind of got sidetracked by a pandemic. So on one level, looking at tobacco misuse and the vaping epidemic, creating policies that would deter youth from continuing to engage in what that business community wanted them to do, which was take up those habits. When it came to some of the adverse outcomes we see in our pregnant mothers, and then as they deliver their baby, what happens in the first couple years of life. There were some significant proposals regarding how to improve nurse and other home visiting programs that are very evidence-based and reduce adverse childhood experiences and do a lot to improve children's educational outcomes as well as all of the social outcomes. We had a proposal regarding after-school activities that really tried to get at that dangerous time between 3 and 6 p.m. when adolescents have more unstructured time and perhaps can engage in some of the adverse activities that might not be in their best interest, such as various substance misuse behaviors. And again, these programs are very evidence-based and can provide marked reductions, and we've shown that in select communities in Vermont, in the uptake of bad behaviors like alcohol use, marijuana use, etc. Those are just a couple off the top of my head.
Thank you.
Avery, WCAX.
Dr. Levine, we're wondering if there's any update to the serology test working group.
Dr. Levine.
I was hoping you'd wait till maybe Friday to ask that, but I'll give you a answer today because it is a topic we love to discuss. That group has just met again for the third time, and literally the report has just landed on my desk. I've tried to give you a little forecast in previous press conferences of what it's going to say, but there are some recommendations regarding our testing strategy with regard to the current tests we're using, the PCR tests on the nasal secretions, which are very much in line with what we have been doing and proposing, and which we'll be discussing as a team with the governor. With regard to the serology test in general, I'm going to come out with a more formal statement, but there's, again, a lot of precautionary advice in the report regarding the lack of real evidence that these tests can be used on an individual basis, the concerns about allowing someone to go back to work, to have a so-called passport immunity because they may have had a positive serology test, and the knowledge of what positive antibodies may mean or may not mean in the COVID epidemic. So those concerns are again restated. And there are some more population level concerns that I'll detail further at another press conference.
Are you able to say when Vermonters will be able to get an antibody test?
Actually, they're able to get one now because a number of conferences ago, we talked about the fact that CDC and a number of states were actually combining data, PCR data, which is telling us about active infections, and serology data, which is really telling you about probability of past infection. We had such a small percentage of those combined that it didn't really impact our test positivity rate or much of our data. It was like 0.something%. However, within the well over 30,000+ tests, there were hundreds of serology tests. So some Vermonters were having them already. Copley Hospital has been using them to test some of their staff, I believe. So these are available. What we tried to caution people about was that the FDA, until in the last couple of weeks, really hadn't validated any of these tests. And so the likelihood of a false positive or false negative seemed a little bit high, and the reliability hence was low. So now there are a few select tests that they have pointed out may enjoy more validity, more accuracy. So if we were to start recommending them, or if Vermonters wanted to start utilizing them, we'd want to point them in the right direction to the ones that the FDA identified. Because there's literally, with these emergency use authorizations in a time of a pandemic when things are moving fast, there are literally tens to hundreds of tests that get authorized for emergency use. But then when you start trying to have the manufacturer really provide the data about how they perform, you find that there's a select group that actually are the ones you'd want to target and use. Thanks for the questions.
Just one quick follow-up, sir. You mentioned Copley where the tests can be done. Are there any other places where Vermonters can seek out these types of tests?
Well, I frankly believe that if they've talked to their own medical clinician and they wanted one of these tests, that they would be able to obtain one through a commercial lab. But that's all I can say. So it's not like we're preventing anybody from getting one, but we're not promoting them on a population-wide basis at this point in time, and I'll have more details on that in the future.
Got it. Thank you.
Brittany, Local 22.
Hi. So, quick question for the governor, and I don't know if it was just me, but you sounded a little hesitant when talking about the possibility of maybe opening indoor seating for restaurants on Friday. And I was just curious if what's going on in Winooski and if there happens to be more cases than what we know of right now, would that impact your decision at all for further reopening?
Well, simple answer is we just don't know at this point in time. We don't know the extent of this. We want to monitor this and take the data that we do receive and make sure that it is accurate and then to make a determination from there. I mean, it's my hope if this is an isolated outbreak, as we think and believe it is, then I see no reason we couldn't announce on Friday the opening of inside dining on a limited basis.
Thank you.
Ed, Newport Daily Express.
Yeah, good morning. My question involves insurance. The auto insurance industry has been giving rebates to people because they're not driving as much and not therefore getting in accidents and needing insurance. My question is that with the dental insurance industry and also the healthcare industry, they canceled, of course, or are not allowed to perform a lot of procedures or even do some of the more common testing and so on. Yet they're collecting premiums at the same levels they were before, which affect us. I know a gentleman who had dental appointments and they were canceled to 2021, yet he's paying the insurance every month. Is there a way that the state of Vermont can claw back that money?
Yeah, I'm not sure.
It does affect us, the Blue Cross Blue Shield, it affects us individually, and it affects the state with its health care coverage.
Yeah. I do know that Delta Dental, one of the major suppliers of dental insurance, is giving rebates. So I do know that's happening. We announced that. Commissioner Pichek actually announced that last week. And I know that he's working with other insurance carriers as well during this downturn. Again, as you alluded to, auto insurance and so forth isn't being utilized as much, so they have reserves and they don't need to collect as much money. Same with Delta Dental. And I know that we've been trying to work with the medical insurance as well to make sure that we're not increasing the amount of money people have to pay in. But again, I know that they were facing a lot of unknowns, and they were actually going to increase by a great deal. But I might let Secretary Smith answer the rest of that because he's more in tune to what's going on.
Okay.
Thank you for the question. I met with Blue Cross Blue Shield. I've also met with legislators and the Green Mountain Care Board and had voiced the concern that you have just raised, that in this time when Vermonters are struggling, this may not be the time to raise rates on Vermonters from medical insurance. And one of the things that I did say is that, you know, there are some of the things that you just mentioned. There have been sort of savings in this year. Now, we have to make sure, as we look at the reserves and we look at everything that has to be put together in terms of rate increases, that we take this into consideration, the savings that will be transpired and any sort of pent-up demand and how that will impact. But I have testified in front of the legislature and I have testified in front of the Green Mountain Care Board that it is something that is of concern to us, that rates are not adverse and impact Vermonters at this time in this situation that we have right now.
Great, thank you very much.
Kat, WCAX.
When the pandemic first started and the state had to make its decisions on what the best way to respond would be, there wasn't, I got the sense, a lot of Vermont-specific data to base that decision on. So now that we have some Vermont-specific data, because we've been through a round of this virus and we have the benefit of hindsight, we did see the coronavirus did not do the level of harm that our original models had predicted it could have. So what would we do differently if we have another major outbreak to mitigate the level of the economic impact to Vermonters?
Well,
Like, will there be a more targeted approach?
Yeah, again, Kat, you bring up a good point. I think we could have been in a lot worse position had we not taken some of the steps we took. And as well as we move through this pandemic, the increased testing and tracing has been so important to mitigating the outcome. So if we, as we look forward, we have learned a lot, and we'll learn how to deal with this until there is a vaccine. So testing and tracing is going to be an important component. It's my hope that we would not have to shut down large sectors if we had another evolution of this outbreak here in the country and here in Vermont, that we could isolate that to different communities or different operations, so that again we could continue to stay open. So we've learned a lot. We will continue to learn more as this moves forward. We'll learn from other states as well, what worked well, what didn't work well, and listen to the CDC, and we'll work together in order to continue to battle this virus.
So what are some of the things that we've learned that could help us the next time around? And would we do everything the same way? I mean, that's, I guess what I'm kind of getting at is, now that we have some bit of hindsight, people are kind of wondering, do we have to do this again? If it's not COVID, if it's another virus.
Well, again, I think I answered that, but I'll try it again. We will not, hopefully, not have to do take the same approach as we did in the beginning, because we've learned so much, and we've increased testing and tracing and our capacities in our healthcare system, and prepared with inventory for our PPEs and so forth. So it would be a much more targeted approach in the future, would be my hope. But again, we're still right in the middle of this state of emergency. We're still learning. We have other states that have taken different approaches. We'll learn from them. They might learn from us as well on how we deal with this. But again, this box-in approach of testing and tracing, I think, is going to be essential in the future with any type of outbreak of any kind of virus, to make sure that we're on top of it. But again, I think we were somewhat flat-footed when this first arrived, but at this point, we're much more seasoned, and I believe that we can take a different approach. I'm going to let Dr. Levine add to that if he'd like to.
And I'll do so much more briefly than my previous answers today. But one thing that the governor emphasized is this containment approach. So always keep in mind, there was no opportunity for containment the first go-around. Not because Vermont was unique and different and fell down somehow, but because we did not have even a test, never mind testing capacity. We didn't even have a test for so long. Nor did we have the appropriate PPE, which would allow so much of what we did and tried to do to protect our healthcare workers who have to obtain these tests. So that's a big component. Physical distancing, facial covering, respiratory etiquette, hand hygiene, none of that was really ingrained in the population from day one, and it had to be brought into more of a cultural change, I would say, very quickly, and people caught on very quickly, which was good. But again, these are things that didn't have to happen every day in everyone's lives until COVID hit. So it's really challenging on a population-wide basis to make all of that instill in people all these new behavior changes, which we always know behavior changes are challenging. The thing that will be different if there is a resurgence or more viral activity than we anticipate is this testing capability, and the fact that we won't necessarily have to do every mitigation strategy that the entire country had to adopt on the first go-around. Everybody had to quickly adapt to very small groups, no mass gatherings, quickly adapt to the fact that the places they enjoyed going were now not open for their business. Quickly adapt to not congregating in restaurants and bars and places of that sort. and eventually quickly adapt to the school issues. So those were things that had to come very quickly and well-timed in the first go-around because there was no other strategy. I'm very proud of our EPI team and the fact that as a state, we tried our darndest to have two parallel processes at once. One was these mitigation strategies I've just detailed. The other was a containment strategy, but the containment strategy couldn't be its own success, and it couldn't be as successful as it might otherwise be because of our late ability to test and the fact that the viral prevalence all across the region and ourselves and across the country was so great. So we've learned a lot from that, and we will succeed as we move along.
Thank you.
Lisa, the Valley Reporter.
Hello. My question is also for Dr. Levine. I want to clarify the availability and process for getting one of the more reliable serology tests. Is the process to reach out to your healthcare provider?
Right now, if an individual wants to do that, yes. But when I come back with a more cohesive package to present at this press conference, I can be very specific about some of the tests that are the more preferred ones right now and about the approaches that one might take regarding testing. But again, I would not want to encourage individuals to seek out these tests with a motivation in mind that might not be delivered upon, because these tests may not actually be able to provide that security that the person is looking for regarding their immunity, regarding their opportunity to work in a certain setting or what have you. So I just want to caution people to be careful. And when I do come back, I'll talk a little bit more about how even a test that looks incredibly sensitive and specific can actually provide you with a false idea based on its result when there's not much virus in the population at large. But save that for a future date.
Thank you.
Tim, Vermont Business Magazine.
Governor, I'm going to take another swing at the $400 million aid package. I know you said much about it. But as you know, certainly the businesses and nonprofit organizations are looking for more certainty. Being sort of hung out with a as soon as possible response is not really very satisfactory, as you can appreciate. Is the legislature giving you any idea of a timeline? Is it going to be 2 months, 1 month, 1 week? I think we all need to have some sort of idea of what the timeline is going to be like.
Yeah, good question, Tim. I wish I had the answer for you. This is probably a better question for the legislature, but I do know the speaker has informed me that they would like to go and break in the next couple of weeks, and then come back in maybe late August, early September. So I would anticipate it would be done within the next 2 weeks. My hope would be it would be done in the next few days. Because, again, I know how essential this is. They can't wait 2 weeks because it's going to have to be put into place, and then it's going to have take a little bit of time to disperse it. So the sooner we get it, the better off we're going to be. So I would advocate just as quick as they possibly can to move through this. But as you know, I don't control the legislature. It's a separate body. So they can, probably a better question for them.
Well, as you can anticipate, they've been pretty quiet about that to us. That's why I was sort of pressing this issue, and I have reached out to them a few times, in fact.
I know they're
about any satisfaction.
Yeah, I know the committees, I believe the committee's been working. I don't know about the committees that have under this jurisdiction, but most of the committee's been working over the last few days. So. I think they're still in session, so I would hope that they're working on this issue as we speak.
Is there? I know there's some the questionable legal issues about how to deal with the CARES money. Is there any regret on your part of not just moving forward the administration itself instead of throwing it to the legislature?
Yeah, everyone's taken a different position on that. I know the majority of states have just done it themselves. The governors have. Other governors have utilized their legislature. That's both Republican-controlled legislatures, democratically controlled legislature with Democrats and Republican governors as well. I had to deal with reality. They wanted to have input, and it was going to be an uphill battle if we didn't get that out of the way in the beginning. And the numbers are so that they could override, as we know, as we've seen over the last few years. They have the numbers to override anything that I do. So I took this opportunity to work with them, that we can work together on this. This is a state of emergency we're all working under. It's a pandemic that none of us have seen before. And this certainly was 60,000 people currently on unemployment and businesses on the brink of bankruptcy as we speak. This is a call to action. We all need to work together and pull in the same direction. And I don't know that I had much choice, but I still believe that we can get through this, and we can get through it working together.
And speaking of the legislature, it looks like they're going to opt you out of the mail-in election. Any thoughts about that?
Well, I think, as you might have recalled on one of the press conferences a week or 2 weeks or 3 weeks ago, I can't remember when we were discussing this issue, because they felt as though I was in the way, that I didn't give them the answer that they wanted, which was to rubber stamp this. But I've said from the beginning, let's just move forward. Let's put it in. Let's utilize the money that was appropriated to the states for this purpose. Let's move forward. Let's plan. All I wanted was a two-step process instead of one. But this has turned into something that it shouldn't be. So again, I'm okay with being taken out of the equation, and it appears they've done so.
Okay, thank you, Governor.
Aaron, VT Digger.
Hello, I have a question about childcare. It looks as if only about half of all childcare providers with active licenses in the state plan to reopen this week, according to data provided by AHS. Are you concerned that without additional state support, too many providers won't reopen at all?
Well, again, I think I'm going to let Secretary Smith answer most of that question, but from my standpoint, having half of them open is good news, because at this point in time, we see a number of businesses that are not open, and we're going to continue to slowly and methodically open up businesses. We have 60,000 people, as I said before, still on unemployment, and many businesses are closed down right now, but we hope to open them back up. So as we open everything back up, we hope child care opens up as well. But I'd say that's fairly good news to have 50% open at this point in time. Secretary Smith.
Thanks, Aaron. The governor mimicked what, well, not mimicked because I'm mimicking the governor. He's absolutely right on this point. I'm pleasantly surprised. We have 50% of child care centers and growing opening up. We've had some bumps in the road that we've discussed in previous press conferences and trying to get supplies to them. We are working those issues through. We've provided a lot of money, as I've said in previous press conferences, both during the shutdown to make sure that the infrastructure stayed in place, and $6 million for the restart as we're moving forward. And we're continuing to monitor, we're continuing to listen, we're continuing to see what needs to be done to bring that number up. And I suspect that number, I'm very pleased with the number that's sort of at the start point, 50%. What we need to do to sort of bring that number up. Again, it's the choice of the particular child care center of whether they want to open but the choice of at least 50% opening is something that I think is a good start for us.
Okay, thank you. I also have a question about the statements Levine made on racial health equity. Considering what we know about, the general health disparities by race and other factors in Vermont, what is the state doing to ensure that testing is reaching marginalized communities?
Well, we do. I'm going to let Dr. Levine answer this, but we now have increased our testing capacity by multiple factors, and so we're at a point where we have pop-up testing that you don't have to have a referral in order to be tested, and we encourage people to go and be tested. If you want to test, get a test. So with that, Dr. Levine?
I couldn't agree more. We've really made this geographically broad, covering all regions of the state. We now have a cluster in one part of the state, and we've actually markedly increased the opportunity to get testing in that specific region. I don't think there should be a barrier to anyone who wants to obtain a test. And certainly cost, by the way, isn't a barrier either at all of these pop-up sites. So I think we've tried our best to do as much as we can to reduce any kind of obstacles that would be in the way of anyone, regardless of race, regardless of economic status, etc., obtaining a test on a fair and impartial basis.
And is there any demographic data on who's getting tested available? Are you collecting that?
I'm going to check into that for you, but I believe that the data that we collect at the time of test is not as inclusive as you might be thinking. There's certain fundamental things regarding, obviously, people's addresses and ways to contact them with test results, but I'm not sure we have it more expansive than that at this time. But I'll get back to you with that.
Thank you. That's all.
Joe, Barton Chronicle.
Heather, this is a question that stems from the report of the outbreak at Ski. It appears that this sort of thing could keep happening at any time, and I'm wondering how that is figuring into decisions that you're making to begin with about how people in nursing homes or in other extended care facilities are going to be able to see their loved ones, visit with family, that sort of thing. And also what the full turn of the spigot is going to look like, given that fairs and other events that have large numbers of people are being canceled. I am that 100% may not be the goal. Is that something that has been determined, or is it still out there to be decided?
Let me take one of those at a time. In terms of whether this has an effect on us and our decision making with outbreaks and so forth, I guess, as I said earlier, this is not unexpected, and I've said this numerous times at numerous press conferences to forewarn. The more we open up our economy until we have a vaccine, we're going to see outbreaks. So we have to determine how many outbreaks in what areas of the state. And if it's confined to one area at one point in time, it doesn't give me a great pause and great concern. But if it happened at multiple geographic dispersed areas throughout the state at one time, then I would be concerned about what was happening. So it does have an effect on us, but in the grand scheme of things, as we look at how we're going to open, we're still looking at the data and the science and trying to determine whether it's widespread or isolated. I think that's the point. In terms of what it looks like when the spigot is fully open, I don't think we can open the spigot all the way. And there may not be as much water coming out as was happening earlier in normal times. And I would expect we might get to that point this year where the spigot might be open, but we're just not seeing the flow that we've had. Probably won't get back to anywhere near normal until next year because the fairs have been canceled. They aren't coming back this year. I think that there's going to be a number of areas that probably won't open back up. A number of businesses won't make it. And if we don't get to them in time with this economic package, we'll have more. So it's hard to say what the flow will look like, but my hope really is to have the spigot open this year, and then by the time we turn the calendar into 2021, that we'll be on a different path than we were this year.
So does that mean, for example, that you expect at some point this year that restaurants, for example, will be able to open to capacity?
That would be my hope. I mean, I don't determine. It's again, it is all based on, we don't control the virus is controlling us. All we can do is mitigate it the best we can until there's a vaccine in place. But if everything continues to move in the right direction, then I would expect that we would be able to open up restaurants to some sort of capacity, yes. And our first step would be, hopefully this Friday, where we can open up to on a limited basis and merge our way into this.
Okay, thank you.
Greg, the County Courier.
Hi, Governor. Hope your day's going well. My question, I kind of asked, I think last week or the week before, what your data is showing as far as how much of the virus is in the community. Obviously, we're seeing, a fairly level growth, a few here and there. Here in Franklin County, we've been well over a month without a new case. So I had asked, a week or two ago, what your data shows as far as how much of the community this virus may be in, without us really knowing. And the answer I got at that point in time was that through the added testing of people that were not showing symptoms, that you would know that data more. Now that we're a couple more weeks in, we're still not seeing new cases in Franklin County. Is that an indicator that the viral load in the county is very, very, very low?
I would say that's good news when we don't see positive cases in other parts of the state as well. And that's why you continue to see us opening up certain sectors a little bit at a time. But as we saw this week, again, with Winooski, to see an outbreak there where they didn't have one before, previous to this. So that's concerning. So again, I think it depends. We don't control the virus. The virus can move about fairly quickly. And as we open up the economy further, we open up campgrounds, we open up more tourism, we're going to see more cross-border issues, I believe, that will flare up, and we have to be prepared for that. But at the same time, if we do this in a methodical way, we can watch what's happening just as we're watching today. Dr. Levine, anything you'd like to add to that? Greg, you want to ask another question?
I guess I just want to clarify what I was really asking is, do you guys have any data of what the viral load is in the community at this given time? And how are you modeling some of that? And maybe that's a Mike Pichek question.
Well, Mike will be, it might be a great question for him on Friday. Mike will be presenting the modeling again on Friday as we consider how we open up to out-of-state traffic without quarantining. So he'll be presenting that 2 days from now.
And real quick, Governor, it was kind of a continuation of the question, but I didn't want to get too lengthy. Using the data that you guys are gathering and modeling, are you guys looking at how some of the protests, whether they be in Burlington, St. Albans, other parts of the state, are you looking at how that's going to affect this, and what is that modeling showing?
Yeah.
Or what do you expect that it's, we're going to see out of that?
I don't know what to expect, but as Dr. Levine had said, anytime you don't socially separate, and the mask use was prevalent, but not 100%. We hope there isn't an outbreak as a result of those protests, but we don't know at this point because it could take a couple of weeks before we see the effects of that. Dr. Levine?
Yeah, to pick up on that last question, so obviously you can't really model for an outbreak related to a certain protest here or a protest there, but you can anticipate that the relaxing of these behaviors that the governor just referred to could increase the likelihood of having an outbreak. We are specifically making sure that if there are positive tests that occur across the state, that we're questioning people to understand if they've been in mass gatherings. Doesn't mean a protest necessarily, it could be at a restaurant or wherever, but just to get a sense for how much people are circulating more with one another, and if that might be part of why they turned out to be a positive test or not. So I think that's important. When you talk about the data from your earlier question, we do look at, obviously, all of our test results from across the state, and when they're in asymptomatic people, we don't expect to see a lot of positives, so I'm grateful that we haven't seen a lot of positives in that population, but those are asymptomatic people. We also look at what we've termed syndromic surveillance data, which is how many people are presenting to their healthcare settings, usually to urgent care or emergency room settings, with COVID or flu-like symptoms. And those are very, very, very low in the state right now. So we don't think we're missing out on a lot of COVID activity in the state, because knowing that maybe 25% could be asymptomatic, there's still a whole bunch that would be symptomatic and that we would hope we would have picked up as part of our expanded testing. So all of the modeling data that Commissioner Pichek refers to all the time, so much of it is contingent on us having this testing capability so that he has the data to work with, as well as the other modelers that we've enlisted to show you some of the data that we put up. They all have to have some data to work with, and much of that is case positivity rates.
So just one quick follow-up, and I'll let you guys go. Governor, you said you don't know what to expect. None of us know for sure what to expect, but what do you anticipate you're going to see with these numbers changing?
Well, again, that's why we're working on this very methodically, very slowly, very cautiously, and because I don't know. And I believe that in doing so, and then just really reacting to the data and the science and making these decisions based on what really is happening is the best policy. And I know it's not quick enough for many. This has been a long, long 3 months, and for those, again, who are impacted by this, that are on the brink of disaster in their businesses and still unemployed and and have had their lives turned upside down, my heart goes out to them. But we're doing the best we can to make sure that we're not putting ourselves in a position that would do harm to people in the state. And it's a tough balance. And we're just, again, we work on this every single day and have our whole team working on this every single day to try and make the best decisions that we possibly can so that we don't, again, we don't cause economic harm, and actually try and turn the spigot on a little bit further so that we can have some benefits from that. But we don't do harm to health either.
All right, we're
Thank you, Governor. Thanks for your time.
Thank you. You still there, Greg?
Yeah, I am now. Somebody muted me in the middle of what I was saying. I was just thanking you for that time. And if you guys can come prepared on Friday to answer the question on how you expect the large gatherings to change some of the data going forward, I'd appreciate it.
Okay, and if we don't, just make sure you have that ready.
Sure, thank you.
Thank you.
Andrew, Caledonia Record.
Yes, good afternoon, Governor. You indicated earlier you're looking at allowing some out-of-staters to visit Vermont without a quarantine or test if they are from low case count states or even certain regions within a state. And you also mentioned in response to Kat earlier that the state may now have the capacity and learn ways to take a more targeted approach in future responses. I'm wondering, would you now consider adopting a regional response within the state, for example, allowing indoor dining or crowd sizes in low-case counties to resume at a higher level than other parts of the state, or perhaps delaying reopening of certain activities in communities that might be experiencing an outbreak?
Yeah, we'll consider anything at this point in time. My preference would be to open up all sectors at the same time and at the same rate. But again, if we have persistent problems in one area, we will look at a regional approach.
Okay. So, I mean, that's a shift in a response you gave me a few weeks ago.
Well, things do change.
Yeah.
And again, this isn't, we aren't opening up near as fast as I'd like to see. So again, looking at the specific data and watching that Doppler map or the heat map and the modeling that we've done, it does give you a sense of what's going on and where. So now that we've increased our ability to really target some of those areas, I think that this gives me a little bit more comfort as to what's going on and where, and watching it move either in a positive way or a negative way. So I think that, again, as we get better at this, which is difficult for me to say because I don't want to get good at this in some respects. I'd rather just go back to normal. But as we move forward, we're learning a lot, and we want to make sure that we're migrating towards a process that works for everyone. So again, when we contemplate this in the future, if there's no vaccine and we have to contain this and accept what's happening throughout the states and the country in the future, I'd much rather take a targeted approach rather than this blanket approach that we had to take. We had no choice but to take that in the beginning. But as we open things up and we move forward further down the road and in the coming months, we may take a more targeted approach. That would be my preference in the future.
And just a quick follow-up, low case regions within certain states really makes Colas County and Grafton County in New Hampshire jump to mind, which is right next to us. Is that some of the areas for instance, that you're thinking about?
Yeah, I think you can really, if you take a look at our heat, our modeling and that interactive map that what Commissioner Pichek had provided, and you can really see the northern parts of New York, New Hampshire, Maine, all have fairly low case counts. So that would be what I would be looking at.
And would you be allowing that just based on like an honor system? I mean, I can't imagine there's an easy way to verify.
I'm sorry, maybe try that again.
And the allowing the out-of-staters from those regions, I'm assuming, as with most other things, this would be on an honor system. There's really no methodology to verify.
Very difficult to monitor that, and my hope would be to talk with the other governors as well in those states to see if there's any reciprocity.
Okay.
Because there, as you know, I mean, Maine is still a 14-day quarantine period at this point as well. So maybe, and I'm not sure what New Hampshire is doing either. Last I knew, they had the same policy. So maybe there's a way for us to work together.
Great. Thanks for your time.
Maria, The Washington Post.
Hello, Governor. Thank you for having this press conference. I have a question about restaurants and bars. It seems like one of the earliest things you did was to close restaurants and bars. And given that, Vermont doesn't have the congestion or subway systems of a place like New York, one of the places that people can come together are in restaurants and bars. And I guess I wanted to ask you, do you think that your decision to close restaurants and bars early is one of the main reasons your numbers are so low now? And are you concerned that lifting that, when a place where people aren't perhaps wearing masks as they're eating, there's alcohol, and they're sitting for hours possibly, could reverse your gains?
Yeah, again, that's why we're taking this very cautious approach. We've opened up outdoor dining. We did that, a week and a half ago at this point. So we're watching the data there. We will be opening up, and we'll have the details of this, but it'll be on a limited basis, and the bars will not be included in this initial opening. So we're doing this, again, very cautiously, very methodically, to make sure that we continue to have the good numbers that we do. So if we had not taken the action we did, I remember this distinctly, how difficult it was to close the bars down 2 days before St. Patrick's Day, which is a pretty big day here in Vermont, as well as in other areas around the country. But I think that reduced the impact significantly by doing so. But it was a difficult decision to make.
All right, thank you very much.
Thank you. Colin, 7 days.
Hi, I have a question for Dr. Levine. When we're talking about tracing the movements of these new cases, specifically in Winooski, is there any indication at this point whether any of the new cases did attend any of the recent protests, specifically the one in Burlington? And if not, is that something that would be shared publicly? Say, for example, one of the new cases was at that rally. Is that something you would tell us at a press conference like this?
Dr. Levine.
So, obviously, when it comes to the new cases, as I said earlier today, we literally just found out about these prior to the press conference. My staff need to go through an exhaustive process with spreadsheets of data and understand what is truly a case, what needs to be, as we call it, deduplicated. It may have been reported somewhere else. So we don't have a lot of details on even the exact number nor the nature of these cases, and certainly haven't interviewed them all as of prior to the press conference, having just found out literally moments before. So as part of that interview process, the interviews are quite exhaustive and comprehensive. So I'm sure that we will learn if anything played a role. Again, not looking at the protest as much as really the idea of mass settings, mass gatherings. That will be really critical detail. But we don't have any detail for you now on that. Your last question was regarding if somebody had attended a protest. Obviously, there again, that's the nature of the work that we do in contact tracing, which I won't give you the full education on during this press conference, but it's a very comprehensive process. It really involves knowing the right questions to ask and making sure that the answers aren't in any way forced or coerced, and making sure that you can assess the risk of others that this case came into contact with. And the same principles that I've talked about many times that really fall into line. How much one-on-one contact was there with an individual? And how long a contact was that? Was there a really intense number of minutes or hours or what have you? Or was it very casual? It's like if you're in a large room like the auditorium we're in now, and someone in this room has COVID, and you wonder about the person sitting in the last row, probably wouldn't even go near that person talking about the fact that they might be a significant contact and should quarantine, because they're far away from everybody else in the room, and it's an isolated case in a very, very large room. So a lot of common sense needs to be used, and if you're at a protest or another mass gathering, it doesn't mean you're destined to become infected because somebody who attended that gathering was infected. It really depends on who that person was with and for how long. So if there was a public health reason to call out a specific protest and ask people to come get tested because we were concerned they all might have been at high risk, certainly we have the authority to do that. I don't foresee that becoming a potential outcome here, but that's certainly something that as public health officials we would entertain for the safety and health of everybody in our population. But we know of nothing like that here in Vermont, and frankly, after watching probably too much TV in the last couple of nights, I am as concerned as other public health officials about some of these very large gatherings in major cities across our country.
Thanks. And then just one follow-up for the governor. When we talk about trying to open up the spigot by the end of the year, do nursing homes fall into that? And I'm thinking as far as allowing visitors. We've heard from a couple of people just interested in when they might be able to start visiting again.
Yeah. You know, it's certainly something that's been on my mind for quite some time. And as I said, I don't want to forget those who are in the long-term care facilities that might be watching this program today. And I know how difficult it is for each and every one of you. And we want to be able to allow your families to come visit in some capacity. So we're contemplating ways of doing so sooner rather than later, maybe in outdoor settings and so forth, and isolated and taking all the precautions. But we know it's important for you to see your family. So it's on our mind. We would like to get there, but at this point, it's just been difficult because we haven't known where this virus is. But as we learn further, hopefully we can relax some of those requirements and maybe come up with a different approach to visiting as well. Dr. Levine?
Just for a second, I was almost going to say there is nothing higher on my priority list, but things keep happening in this pandemic, so I can never say that. But very high is this issue of visitation, families and their loved ones in nursing homes. The families want it, we all want it, the facilities want it. We all want it to be done the right way and very carefully and armed with the right data so that we don't make mistakes. So we are actually on a daily basis not only talking about it, but meeting about it, developing strategies. It will all be complementary to our testing strategies, which will help facilitate that, but it's nothing, it could be closer to our minds right now. And obviously, the Vermont summer is not always our longest season, so we really want to try to do this in a timely way, but it has to be done very, very safely. And we don't want to be too far out in front of our skis on something that's this important with such a vulnerable population.
Thank you.
Steve, NEKTV?
Hello, can you hear me?
We can.
Thank you. A couple for the governor, and one for Dr. Levine. Dr. Levine, I believe it was last week or so when they found a cluster of cases in Winooski.
Oh, is that the
Last
question?
week.
Hold on. Yeah.
The answer is yes.
Yeah. The answer is yes. Latter part of last week.
Okay. Okay. So has your contact tracing determined where any of these cases originated from?
The contact tracing helps tell where it originated from, but more where it went to, because the cases are where it originated from for the contacts, if you will. But yeah, we have learned a lot, but it's really an ongoing process because not every contact, as you know, becomes a case. There are a person who may be at risk of becoming a case, but that's all. So we're still, it's still very early in this investigation, and it does take quite a few days for this to play out. So I really can't share any other information with you regarding a specific, source, if you will, or anything like that.
Thank you, Doctor. Governor, you just said that you don't, regarding the $400 million, you just said that you don't control the legislature, but you do control the spigot. So by keeping businesses closed and asking for $400 million to keep them afloat, aren't you going to be kind of like taxing Vermonters of all Vermonters of all walks of life to pay for the certain sectors that you personally are keeping closed?
Well, I think you can go across the country and see the ramifications of this pandemic. It's not just here in Vermont. It's throughout the United States, throughout the world, for that matter. It doesn't matter whether it's China or Spain or Italy or the United Kingdom. Everyone has suffered together on this. So there is going to be economic ramifications from this regardless of where you live. And that would go for Canada as well. So I'm not sure that we can, I'm not going to base all my decisions on the economy. Health and safety come first. And that's what I'm trying to do, and find that balance. So until that time, the federal government, Congress has given us money to use as a way to supplement, as a way to help, and to keep some of these businesses viable so that when we do come out of this and we do find a vaccine, that they will be ready to go and still intact so that they can go back to somewhat normal.
Okay, but how do the Vermont statistics compare with statistics like free states?
Steve, I don't know how many times we have to go through the regional data. I mean, I showed you last week. I don't know if you can, maybe you're not watching and haven't seen the modeling, but if you get an opportunity, look at the modeling that we produce. I mean, we just, when you look at the region and you look at Massachusetts, for instance, which again is only 2 hours, and I can be right in the heart of Boston, and you can see what's happening there. In the last 3 days, they've had 4,000 positive cases. 4,000 positive cases in 3 days. So to just blindly not be aware of that situation, they've had 200 deaths in 3 days. So we can't close our eyes to that. We're a region. Just because we have borders doesn't mean it's not going to affect us. So we have to look regionally. It's not just about the state.
Oh, sure. And maybe you drive faster than I do. It usually takes me about 3 hours to get to Boston.
Well, you come from the Northeast Kingdom, don't you?
No, actually, I was born and raised in Lunenburg, in Lunenburg, Massachusetts.
Oh, okay.
But anyways, regarding the vaccine, there's a lot of people, a whole lot of people, like 30% maybe or more, who object to getting flu vaccines and would not be, receptive to taking a vaccine should one be developed. Would there be ramifications for not taking a vaccine? Would vaccines ever become mandatory?
I think we're getting ahead of ourselves a bit, but it's going to be a fascinating debate. I'm one who believes when there's a safe vaccine, we certainly have seen the merits of having a vaccine to stamp this out. So look what it's done to us. Look what it's done to our economy. Look what it's done to our way of life. And if we can have a vaccine that's safe and effective, we should do it.
Yeah, a lot of people don't object so much to the vaccine as they do to the adjuvants in the vaccines, but that's a whole nother story. Thank you very much, Governor, and thank you, Doctor.
Guy Page?
Governor?
Guy?
Yes. Hi, Governor. So WAMC reports that Massachusetts State Police have sent officers into small towns in Berkshire County, speaking of Massachusetts, in Berkshire County on the Vermont border, specifically looking for Antifa activity. I spoke with Lieutenant Lone of the Vermont Intelligence Center today. He said these reports may be based on misdirection from white supremacists. But be that as may, I'd like to ask either you or Commissioner Shirley, are you concerned about Antifa activity in Vermont? And if so, what are you doing about it?
Yeah, I haven't heard of those reports. I would be happy to have Commissioner Shirley answer that.
Thanks for the question. You've already been in contact with the Intelligence Center. We're monitoring this situation on an ongoing basis. We have no specific concerns at this point about Antifa presence in Vermont, but we'll continue to monitor.
What does that monitoring look like?
I think I'm going to hold the answer to that for the intelligence folks. You can imagine it looks like taking in information from people in our communities as well as scanning what's happening out on the internet.
Okay, thank you.
And that concludes the questions. Look forward to seeing you all on Friday. Thank you very much.